Welcome to this webisode. I'm Dave Clausen, the co-director of the Mid-America Prevention Technology Transfer Center. For this webisode, we're excited to partner with the Community Anti-Drug Coalitions of America, also known as CADCA. For this webisode, we wanted to highlight their annual survey of coalitions. It's a leading source of information on community-level substance misuse prevention. The survey is going to provide insights into the coalition processes, strategies, and activities aimed to reduce substance misuse efforts to improve population health. CADCA welcomes all community substance misuse prevention coalitions to participate. You do not have to be a CADCA member to contribute, and their 2021 survey is currently open, and I'll post that link in the notes below. Now, inside this webisode, Dr. Albert Trillian, the Director of Evaluation and Research for CADCA, will showcase the 2020 Annual Survey of Coalitions and detail what great information their state-specific reports have to offer you. But before we get into the content, we would like to thank our funder, the Substance Abuse and Mental Health Services Administration. And a quick note, funded by SAMHSA, the content of this recording does not necessarily reflect the views of SAMHSA. Without further ado, let's get into today's webisode.
All right, thank you, Dave. My name is Albert Trillian, and I'm the Deputy Director for Evaluation Research for Community Anti-Drug Coalitions of America. Now, the shorthand for this is CADCA, and we do serve thousands of coalitions across the country. We provide trainings, we provide different meetings, annual meetings, and technical assistance, and really help support the prevention field. One of the biggest projects that we oversee is the annual survey of coalitions. This is a survey that we open from January until May every year. It's been going on since 2005. It is the largest repository of coalition data in the country, and it allows us to not only speak on behalf of coalitions to legislators on the Hill, it also allows us to target the support that we're giving to coalitions and their partners and the many levels of the prevention infrastructure. It's a questionnaire that takes probably about 45 minutes for a coalition, and that allows for a good exchange of information about how coalitions work, the different processes they undertake, and what outcomes they think they're seeing. It's not a formal tracking of outcomes. It is very much a process-oriented instrument, but it does give us an idea of the work that's happening and how successful they are. The NPNs in the states are one level of that infrastructure, but we also work with other levels as well, making sure that even regionally, the people that are a part of prevention work have a chance to see what's happening in their areas. The annual survey gives a lot of insights into coalitions about not only the people that are a part of that coalition. It does talk about those strategies and activities as well. If we look at some of the examples of information that we're getting from the annual survey, we can go back to the coalition that's been around for the longest in respondents. And this year, it was the one founded in 1968. The months during which coalitions are most frequently started. This is September, and we are paying attention here to how they're funded, likely those DFC-funded coalitions starting at that time of the year. 49% of all respondents are rural, and this is a point of pride for CADCA, that we know that we're giving support to the people that may need support the most. And this does mean it's people that are not around a lot of resources, large urban settings, and these are the people that we like to look at for the support that we give. About 21% have an umbrella agency, an overarching agency that support their work. And then that budget is about 100 to 149, the annual budget. And again, that does speak to the DFC program as well, but also those that have put together a good sustainability plan past the life of the funding from the Drug-Free Communities program. 1 to 2 full-time staff members, and then a lot of engaged volunteers, 11 to 25. A quick overview of how coalitions are set up and some of the timelines that are involved. Of course, we know that all coalitions are trained to work across sectors. We can see a good example of more popular sectors here, the faith community, law enforcement, and business groups. We see also with this piece of data, great opportunity, a real chance for state level coordination to provide support and to help improve how coalitions work. If we look at the grant funding, there are a lot of different ways that coalitions are supported. We did mention the Drug-Free Communities program, but we're also capturing the data from the PFS program, from STOP Act, even PF subfunding. We capture that data as well. And we can see here that a pretty good number of our respondents are drug-free community program participants, but 40% overall are non-DFC programs, which really helps emphasize how important this data gathering is. There is a progress report. The progress report only covers DFC program participants, where our survey actually gets a broader pool and looks at coalitions across several different areas. For the legal status, about 42% have 501c3 status. They have their boards of directors, and then 80% do have a physical agent. And of course, there is going to be a cross-pollination between those two areas, but it gives an idea of the structure of coalitions and that they're set up to last and they're set up to work across several different areas with a tighter infrastructure and with good sector support. We see the top substances that are addressed. These are things which should not be a surprise to most of the people that are paying attention to prevention work. Alcohol continues to be an issue. Marijuana, of course, is increasingly important for coalitions. Tobacco, prescription drugs, and then binge drinking. One thing that we've noticed as well when we do a little crosstabs on analysis of this data is the increasing prevalence of polyuse, of using more than one drug at once, and what those interactions can mean, and how important it is to work toward that prevention. One of the frameworks, one of the identifiers for the CADCA model is the 7 strategies for community change. It was invented in 2005 here at CADCA in partnership with the University of Kansas. And the 7 strategies, the science shows, when they're all addressed, really do make a difference. What we're trying to do, based on the data that we have here and data that we see in other places, is to encourage coalitions to work across both those environmental strategies as well as the individual strategies, to throw a little bit more time into the changing of the physical design, and to pay attention to the long-term work of modified policies and interacting with their legislatures. And we're trying to give them the tools to do that and do that well and effectively. Top activities, public awareness campaigns. It does speak really to the value of coalitions and sharing information, media advocacy, really paying attention to the people within their community, working with law enforcement, and again, working with making sure that people pay attention to what's good for their community. A strong policy target around youth, but also focused on businesses, working with other levels of the government, and then working with parents as well. Overall, 208 policies changed across our country, according to the respondents to the annual survey. And that's a lot of work, very important, and cannot be underestimated. So with that, that's the end of the overview of the annual survey of coalitions from 2020. And now I'll be happy to go right into an example of what a state-to-state report can look like. An example of a state level report right here is with Missouri. And again, this is all data taken from the 2020 annual survey of coalitions. The Missouri State Report, when we look at it, really does bring in quite a few coalitions, a very robust participation, and it allows us to show what some of the highlights are for Missouri and what can some coordination do for supporting that work within one specific jurisdiction. And again, there's regional level efforts here as well. Whether we look at PTTC or HHS regions, we do coordinate information by that level as well. The CADCA annual survey provides some understanding of who is a part of the coalition, what are their processes, how they work, and what are some specialized activities that help them to claim that success and work toward community transformation. As we see, again, the participation from Missouri really is outstanding. We have both where these coalitions are located in the years that they were founded. We can see here we have coalitions that were founded back from 1983. We know that a lot of these coalitions had their start with the Drug-Free Communities program, but they followed the CADCA model. They worked towards sustainability, and they're able to keep that coalition and that work moving forward. And these coalitions are a terrific example of this. When we look at the staff and the stakeholders, the people that are involved in coalition work, we can see that faith community, public health, elected officials, these are the parts that are strong participants and strong partners for coalitions within Missouri. A lot of coalitions in Missouri have 3 to 5 staff members, but most of them have 1 to 2. And then quite a few of them work with well over 11 volunteers in the work that's happening. If we look at membership, we can see that pretty much half of those coalitions changed leaders, and close to half changed members. There is some attrition within coalitions, and we're able to track this by state. And again, be ready to provide support for those that may be entering into the prevention world, especially those located within Missouri. 85% have re-engaged members, members that may have had to fall to the side because life gets busy, and they're active at re-engaging them. And then 45% were able to actually increase membership diversity and increase those that are a part of their prevention work. If we look at grant funding, a pretty good portion have the Drug-Free Communities program funding. Some have PFS grants and STOP Act, and then some are subrecipients for the PFS funding. And when we look at the funding sources, we can see strong in-kind contributions and support from the federal government, as well as that important sustainable work of engaging in fundraising and reaching out to foundations. If we look at the different budgets for coalitions in Missouri, quite a few of them are working on 9,000 or less, but they're making it work. But then you have that collection, which is around the DFC level, and then well over from $200,000 to $299,000 per year. If we look at some other parts of the annual survey, we can see that all the coalitions that responded in Missouri are working on alcohol, which is an ongoing issue for coalitions nationwide. If we look at all the surveys together, with all the states brought together, it's very much a similar story that alcohol is an important issue, as well as marijuana. In Missouri, prescription drugs are an important issue, and then tobacco and binge drinking as well. We do some analysis, and we can say that polyuse is an increasing problem in coalitions nationwide, and it's going to be the same way for Missouri. Combining drugs creates new problems. It creates both physiologic but also tracking problems whenever someone's pulled over, and if they have something which is not alcohol but a combination use, it's hard to determine other than physical reaction what's happening there. And we're trying to pay attention to how we can give support to that effort. If we look at the products with which they work, and we are speaking of the CADCA model, we can see that quite a few of them were revised in the last year. Their assessments, their logic models, all the tools with which coalitions are trained to make a difference within their community. And then those that were revised as a result of CADCA technical assistance. Again, it's the ongoing work of CADCA that there's a chance these are not stagnant products. They're dynamic. They have to work from year to year and undergo that transition. And we're there to provide support for that. One more element of the CADCA model, the 7 strategies for community change. There's a real chance to work across these 7 areas. And this is what transforms communities. When all of these things are done together, we are reaching out to coalitions to make sure that they are able to pay attention to those environmental strategies and give them the same attention that the individual strategies are getting. Changing consequences and changing physical design, not always the easiest things to do, but with the right kind of technical assistance, we can get them up to the same levels as coalitions providing information. Top activities, of course, awareness campaigns, media advocacy, working on workplace initiatives, and then working with state policy change and compliance checks. Those are the top activities for Missouri. And the policy targets, government, education, business, and communities, with 24 policies changed nationwide. Some really good information, some good things happening in Missouri, and we know there are things happening in other states as well. We try to issue state reports to the National Prevention Network and that state coordination. This is just one example. We know that states are important. We know that state coordination is important, and we're here to support that as well. We're happy to answer any questions, and you can reach out to us anytime.